Welcome, everyone. I am so incredibly glad to see all of you here today. As you get ready to finally make that huge leap, transitioning from the safety of the classroom into the profound and, let's be honest, sometimes messy reality of actual clinical practice, we need to have a really important conversation. You've absorbed the theories, you've highlighted the textbooks, but today's about you, the practitioner. We're looking at how you actually take all that textbook knowledge and apply it in the room with real, breathing families. Okay, let's dive into this explainer and kick off the paradigm shift that is literally going to define your entire career.
So, think of this agenda as our syllabus for today's training session. This is the roadmap that's going to guide your transition from classroom theory to actual clinical practice. We'll be hitting systemic versus individual approaches, the Quest family case, fostering resilience and recovery, your family of origin, and finally, becoming the differentiated practitioner.
Section 1. Systemic versus individual approaches. Right off the bat, we're tackling what is probably the single hardest adjustment for novice practitioners, breaking away from that traditional individual pathology mindset.
Now, what's really interesting about this slide is that systemic practice isn't just about how many people you can physically cram onto the couch in your therapy room. It's a complete fundamental shift in how you think about their interdependent transactions. Look at that individual column for a second. It's all about the self, coping responses, fixing symptoms against these fixed norms. It kind of assumes your one measly hour of influence a week can magically outweigh the other 167 hours of your client's life. Now look at the systemic side. Here we're looking at mutual influence. The whole family is in the room, and we're trying to understand the actual purpose of what might initially just look like a pathological symptom within that system.
To really wrap our heads around this paradigm shift, we've got to look at Bronfenbrenner's ecological model. It's a fantastic reminder that we just can't view a client in a vacuum. They're deeply embedded in microsystems, mesosystems, and these massive cultural macrosystems. It's like a giant puzzle. If you want to be an effective therapist, you can't just treat the individual piece. You absolutely must address these multiple levels of a client's environment simultaneously. It's complex, for sure, but man, is it necessary. Moving on to Section 2. The Quest family case. So, how on earth do we make all of this abstract ecological theory concrete for your day-to-day practice? Well, let's look at a real clinical example. I want you to meet the Quests. They're going to be our standard case study as we go through this journey. They're a blended, multicultural family, and by testing different therapeutic models against this one single complex family system, you're going to see some really distinct differences. For instance, you'll see how a structural therapist might completely reorganize their boundaries, compared to how a narrative therapist might help them rewrite their entire family story. It's going to help you figure out the therapeutic approach that genuinely fits your own worldview. And this brilliantly illustrates the sheer, vast landscape of theoretical models you're going to learn to navigate. Look at this. We go from the early pioneers of object relations and structural counseling, all the way through postmodern narrative therapy, right up to modern evidence-based approaches. Think Susan Johnson's emotionally focused work, or the Gottman method. Each box here, it's a totally different lens for viewing and helping the Quest family. And hey, your job isn't to just blindly memorize these. It's about seeing how they actually operate when the door closes and the session starts.
Section 3. Fostering resilience and recovery. As we shift from history to modern application, I want to purposefully pivot our focus completely away from that old, tired obsession with family dysfunction.
Listen to this quote. The ability to recover, heal, and grow after facing adversity or personal and often family challenges. I really want you to internalize that. Modern family counseling isn't about being a mechanic fixing broken parts. It is fundamentally a strengths-based practice. We're actively hunting for that inherent resilience. Now, when a family actually shows up at your office, they are usually in total chaos. Cumulative stresses have piled up, the status quo is completely shattered, everything feels overwhelming, unsafe, spinning entirely out of control. It's chaotic, it's loud, and they're going to demand you fix it right then and there, preferably in the next 45 minutes. But wait, listen to me closely here. Your first task in this chaos is not problem solving. Actually, scratch that. It's not even about making rapid-fire decisions. Your first task is simply staying intensely present and beginning an exploration. You literally need to act as an antidote to the criticism and failure these families face every single day. How? By actively activating their resilience. You've got to replace their negative judgments with genuine reframing and encouragement. Treat the family as the absolute experts on their own lives. Note the strengths they've already shown just by walking through your door. Focus on optimism and relentlessly hunt for those internal and external resources they've completely ignored or forgotten about. Which brings us to Section 4, your family of origin. All right, take a breath because I need to turn the mirror onto you for a minute. This is deeply personal, but you cannot divorce yourself from the clinical work. You are the instrument of change. So the crucial point is this. If you don't actively explore your own 3-generation geneograms, if you don't dig into your own unmet needs, you are going to unconsciously work out your personal issues with every single client that walks into your office. Unexamined family issues will inevitably emerge as emotional reactivity and countertransference. And when that happens, you have to ask yourself, who are you actually treating? The family sitting right in front of you, or your own family of origin? The legendary Virginia Satir used to say that when you walk into a room with 12 people, you meet everyone you ever knew. It's so true, right? The people you're most likely to project onto your clients are your own family members. So we map these traits out. Look at Jim's wheel of influence here. You put yourself right in the center, and you map those influences, maybe a hyper-patient father, a critical grandmother, a super-resourceful sister. You've got to know exactly what traits you're carrying into that therapy room so you can catch yourself when a client triggers them.
Moving to our final section, number 5, the differentiated practitioner. Why put ourselves through all this intense self-reflection? Because that self-awareness leads directly to our ultimate goal, maintaining a deeply grounded professional presence.
Murray Bowen famously called this the differentiated self. It's basically the ability to keep a crystal clear sense of exactly who you are while simultaneously staying emotionally connected to the family you're treating. It means you can sit right in the eye of their chaotic, swirling emotional storm, avoid the pull of their reactivity, and just observe it with genuine fascination. You don't get triggered, you get curious. To actually achieve that kind of presence, you have to prepare yourself before you even touch the doorknob to your office. Virginia Satir developed this beautiful centering technique for this, and I want you to imagine doing it. First, close your eyes. Just focus on your breathing. Notice the air coming in and going out. Release all that physical tension. Next, she'd have practitioners visualize looking up at the warm sun, pulling that warmth right into their center to release any fear. And finally, clear the screen of your mind. Just gently wash away any past projections, so when you open your eyes, you truly see the family sitting in front of you. When you can do that, you unlock the core clinical qualities required for this job. And check out the top of this list, presence. Presence is, without a doubt, the absolutely crucial, most important quality you can possess. It's the foundation. It's what allows you to offer genuine caring, and it gives you the courage and assertiveness to set clinical boundaries without getting defensive.
Let's move to and see how this builds into your ongoing development. You have got to learn to tolerate quiet times in the room. When it gets silent, don't just jump in to rescue the moment or fill the void. Use that silence. Observe the transactions happening right in front of you. Reflect internally. This quiet reflection during the session, combined with dedicated journaling afterwards, that is exactly how novice practitioners grow and evolve over the span of an entire career. So as we wrap up this explainer, I want to leave you with one final provocative question. Before you sit down in that chair, before you even attempt to unpack the complex, painful, and beautiful history of your very first family, are you truly ready to face your own? The work starts with you. Thank you so much for your time today, and I absolutely cannot wait to see the incredible practitioners you are all going to become.